Hi everyone, I want to talk about constipation. Constipation. Okay, I would define few things like cathartic colon. That is the situation when someone is on laxatives for a prolonged period of time. So cathartic colon and normal bowel emptying is variable. To some, it is once every day, and to some other people, it is once every 3 days. So it depends. So when there's alteration in your normal bowel emptying times, then you can start talking about constipation. Like someone who goes to the washroom to empty the bowel every day, now staying 3 or 4 days, can't get it, that is constipation. The history will involve asking the affected individual that when you pass through, is it hard? Is it lumpy? And do you have less than 3 bowel movements per week? Depends on what the individual will regard as normal bowel movements. Like what I've just said in the last few seconds is someone could be having bowel movement once in 3 days. To such an individual, less than 3 bowel movements per week may not be applicable. Straining to defecate or sensation of incomplete emptying, sensation of obstruction at the inner region, or you need digital disimpaction before you could defecate. All this will give us clue to the possibility of constipation. What are the possible causes of constipation? It could be inflammatory bowel disease or irritable bowel syndrome. Irritable bowel syndrome could be in 2 ways. It could be irritable bowel syndrome with diarrhea or irritable bowel syndrome with constipation or combined. An inflammatory bowel disease most of the time is with diarrhea, but sometimes with constipation. There's possibility of eating disorders because some that are having eating disorders might excessively use laxative and they have cathartic colon. When people are on low fiber diets, constipation is likely. High protein diet and lactose and dehydration will all enhance constipation. Many medications could be implicated when it comes to constipation. Antacids for GERD or for the treatment of pelvic ulcer disease could cause constipation. Antidepressants could give constipation, and antispasmodics, because it's decreasing peristalsis, can give constipation. Progesterone, and that is the reason where in pregnancy, the pregnant women, not only because of the pressure effect of the uterus, but because of the high level of progesterone that relaxes or smooth muscles, could lead to constipation, and might be the reason why some of them will actually have bloating and vomiting. Antihistamines could give constipation. Opioid will give that, and that is why sometimes when we prescribe opioid, we'll give laxatives as well. Calcium channel blockers might be because we need calcium for muscle contraction, and anti-diarrhea medications because you don't want the individual to be going to the washroom all the time. You want to reduce it. Loperamide is given, and that will lead to constipation. Laxatives overuse, and like I've just said, that is going to give cathartic colon. Diuretics, because 2 problems will happen with diuretics. You're going to lose potassium. It depends on the type of diuretics anyway. If it is not potassium sparing, you're going to lose potassium, and low level of potassium will give paralytic ileus. And also, you are going to send the fluid out, and that will give dehydration. Dehydration, low level of potassium leading to constipation. Cholestyramine will also give constipation. Cholestyramine is used in many ways. Those who have cholestasis with itching and so on and so forth. Paralysis. Spinal paralysis, congenital megacolon in the newborn, depression because everything is down in them, and hypothyroidism, hypocalcaemia, intestinal obstruction. That is even a major problem that might require surgery, or sedentary lifestyle will all cause constipation. Also, pregnancy and pressure effect, in addition to high level of progesterone that is meant to relax or smooth muscle, will cause constipation. Colorectal carcinoma that was going to block the passage of the feces, and diabetes mellitus type 1 or type 2 when there is possibility of neuropathy. So neuropathy that is going to complicate diabetes mellitus will lead to constipation as well. Hypocalcaemia, I've just said it, when you are using your diuretics, if it is not potassium sparing, if it is not triamterene, amiloride, or spironolactone, then you are at risk of low level of potassium. And when there's low level of potassium, you are at risk of paralytic ileus, which means peristalsis is impaired. And when peristalsis is impaired, the gastric emptying will become prolonged. And when that happens, the intestine, particularly the large intestine, will be absorbing the liquid that is in the feces and making the feces to become hard. And when that happens, constipation is there. Pan-hypopituitarism going to affect all lines of hormone production, including thyroid, giving us hypothyroidism and the likes. Multiple sclerosis, systemic sclerosis, myotonic dystrophy, all will slow the transit. And sometimes when we don't know the cause, we give it another name called idiopathic. Now, how are we going to treat this? First thing is to educate my patient on what is going on. From the history, we're going to make proper diagnosis, then we're going to educate. Educate that the individual should be taking more water. 2 glasses a day is fine. Warm liquids like soup when you go to a restaurant or Chinese restaurant, make sure you have soup along. Increase the fibres, and you're going to get that in fruits and leafy vegetables and some other food items. Increase bran cereal, increase exercise. Stop sitting down on the couch for hours. Purge, or some people use the word go. Go once you feel the sensation, because there's what we call gastrocolic reflex. It happens more commonly in children. That is why children, immediately they finish eating, some of them will poo. So in adults, we're still human. When you feel the urge, don't hold it. The more you hold it, the more you are going to get constipated. Stop offending medications, because your doctor is going to work with you to get that and going to remove the offending medications. I've just talked about the list of different medications that could cause constipation. If this is intestinal obstruction, your doctor will know that from the history and physical examination and abdominal x-rays. It's going to be like frame type on X-ray if it is large intestine, and step ladder pattern if it is small intestine, and of course with the history of possible carcinoma or past surgery that's going to give a clue to small bowel obstruction. Everything will make it clearer to your physician. Treat any associated medical problems that could lead to constipation. Ripe bananas will be good to treat constipation. Unripe bananas will actually increase constipation. Get that fast, okay? Decrease alcohol level, because alcohol could increase constipation. Less fatty or fried foods. If you are the type who is known to be having constipation, decrease that level, please, and decrease milk consumption as well. You can try some of these items here: honey, beans, coffee, decreased processed foods, prunes, apples, vegetables, raisins, rhubarb, soya oil, olive oil, sunflower oil, and the list goes on. Pharmacological intervention will be necessary when you have increased sorbitol-rich foods like peaches, pears, cherries, grapes, raisins, and so on, and you know weaning, then laxatives should be commenced. Like stimulants, for example, psyllium and methylcellulose could be used. If you are not weaning, you can try polyethylene glycol. If that's not solving the problem, lubiprostone or linaclotide could be used. And you can add prucalopride if this is a female with recalcitrant cases. Metronidazole if the individual is on opioids. So referral to gastroenterologist would be a good decision. On laxatives, I'm just going to leave the whole presentation about laxatives separately because there are a lot of them and we need to talk about how we make selection. Like food softener like doxate sodium and doxate calcium and glycerin suppository, can use animals, some use water, animals, and so on. Osmotic agent like PEG, lactulose, sorbitol, magnesium sulfate, magnesium hydroxide, and bulk laxatives like psyllium, methylcellulose, wheat dextran, and in pregnancy, we use psyllium and milk or magnesia. Stimulant, laxative like bisacode, and of course, Senna or Senocort. So there's a lot. I will talk about that fully later on. Investigations. Many cases, we don't need any investigation, but some cases when we are suspicious of definitive cause, then we need to do investigations to make definitive diagnosis. For example, if you are thinking this is likely going to be as a result of obstruction secondary to colorectal carcinoma, then we do colonoscopy. If we are thinking this is hypothyroidism based on the history, then we do thyroid stimulating hormone test. Paralysis studies, if we think that this is paralytic eye loss somewhere, or laboratory investigation, complete blood count will give a picture that is going to give us an example of occult bleeding. Electrolyte imbalance, when we're thinking of diuretics usage or inadequate intake of potassium-rich foods or hypocalcaemia somewhere that is giving paralytic eye loss, then we do electrolyte investigation. Fecal occult blood test or fecal immunochemical test when we're suspecting occult bleeding in an elderly person with anemia and constipation, we think the individual is having occult bleeding. Anorectal manometry, we want to know what is happening in that region with balloon expulsion test. Barium or magnetic resonance differentiography and physical examination for masses, fissures, or hemorrhoids. Complications of constipation, hemorrhoids, defecation, syncope, rectal prolapse, abdominal pain, vomiting, bloating, and blood in stool. In conclusion, it may be a mild situation or could actually be bowel obstruction. Just contact your physician. He or she will be able to help you out. Kindly subscribe to my channel so that you can get these publications immediately they are released. Thanks.